My name is Dr. Louis Rose, and I'm a periodontist as well as a medical doctor. And I live in Philadelphia, and I've been practicing periodontics for over 40 years. I purchased my Periolase in 2013, and I've been very, very successful with my patients in treating periodontal disease. When I was first introduced to to Periolase, I was very skeptical, and I was wondering how I would do something that I really didn't believe in. But as I was introduced to the laser by way of education, and I have to say Millennium has a great educational courses going for training, I started to understand what the laser can do. And I know when I practice, if I don't believe in something, I cannot give that to my patient. I cannot talk to my patient about it. But with the education that I got, it became very easy for me to say, this is something I think I can help my patients. And that's where I am at this point. My initial thoughts, originally, they were somewhat negative. And I think the reason for it was I didn't understand how the laser worked. But at boot camp, there were some superb educators. And little by little, after the last day, I said to myself, I think I owe this to my patients. What really turned me on was the clinical training that was part of the course, and as well as the research. Granted, research still is needed, but I have read some very impressive case reports and studies that have been done, and I think the company really is doing their best to keep going with the research. Well, the first thing that I had to do was really to train my staff, because if the staff doesn't believe in it or I don't believe in it, we can't do it. We can't present that to a patient. So it took me a little while to work with the staff, and they are very, very enthusiastic about it. The dental assistants, dental hygienists, even the girls at the front desk were anxious to have this in the practice. And now, if a patient comes in and seeing the hygienist, and if that patient needs some treatment and the laser is a possibility, the hygienist talks to the patient, and makes it very easy for me then to come in and discuss it in more detail. Being a physician as well, I'm an MD, and I always try to relate things to medicine, because patients seem to understand medicine more than dentistry. So when I say to them that in the medical arena, lasers are everywhere, every specialty, and in dentistry, now you're seeing the same thing. And then after I tell them that it is much less invasive than traditional procedures, dental procedures, they're really ready to listen. And so we've been very successful in recruiting these patients. I'm very comfortable with where I am at this point in time. And the interesting thing is, as a periodontist, I depend on referrals. And for me, the patients have been my best referrers. Not necessarily the general dentist at this point in time, but my patients, and that says a lot.